Globally, around 2.45 million people are affected. It's not necessary it will be cancer, but come consult the doctor and get it checked out. What is this? It is you who will notice some change in the breast. Nobody can notice it, but the word cancer, it breaks everybody's backbone. They show that we are brave, but internally we know it's big. First of all, the cancer patient needs support from their family members.
Hello dear friends, good evening. This is Jasila Mujib welcoming you to a brand new episode of BMC Global Live AL-HILAL Health World, Nothing But Lifestyle. In each episode of this talk show, we try to bring before you an expert doctor from AL-HILAL Hospital to address your various health issues. October is the Breast Cancer Awareness Month, a month dedicated to early detection, education and support. Our goal is to spread awareness and to remind everyone that early detection can save lives. And the doctor joining us today is Dr. Nusrat Jabeen from AL-HILAL Hospital, Muharraq branch. She is a general surgeon with an experience of more than 13 years. So Doctor, welcome to the show and thank you for joining us today.
Thank you very much. I'm Dr. Nusrat Jabeen and I work as a specialist in general and laparoscopic surgeries, and also I do perform the breast surgeries. And presently I am working in AL-HILAL group of hospitals, especially Muharraq branch.
So Doctor, our topic of discussion is breast cancer awareness. So how common is breast cancer globally and especially in our region, Bahrain, and who is most at risk?
Globally, in yet census for 2025 is pending. It will come after the October. So till 2024, the globally around 2.45 million people are affected. So this is the globally. Mm-hmm. So in Bahrain, if you get, there is a Gulf Cooperation Council, which have a clear vision on that. They are monitoring actually the all percentage of all type of cancers, like whether it is a colon, whether it's a stomach or the breast. But among that, the breast cancer in Gulf, first we will see, is around 9.7%, touching 10%. But in Bahrain, it is almost touching 4 to 5%. Detection of the breast cancer. Rather it's more because census is not always, all are not reporting to the hospitals, and they will get they admitted or treated and all that, because census are usually taken from the either hospitals or health centers or wherever the patient will report. Many are dying at homes, which is the iceberg phenomenon. Like the one we are talking about, the affection, it is only the tip, what is we see above the water of the ice, and below that we don't know who are not reporting or dying at the homes. That we cannot include. But if we see literally as per rate coming to the hospitals and census, it is touching almost 5 to 6% in the Bahrain.
And Doctor, who is most at risk of breast cancer?
See, there are many factors for the development of breast cancer. But generally we categorize them in the two, whether it is genetic or environmental factors or personal factor. Genetic, before 1 century actually, it was considered that genetics is the most important factor. Only those people are getting breast cancer or any other sort of cancer who have genetics, like heredity. But no, it's totally changed now. Genetics causes only 2% of breast cancer. Globally, I'm talking, not in Bahrain. Genetic causes 2.3%. Let us take 2.5% highest. Rest is other causes which we will categorize in the environmental factors and personal environmental factors, like lifestyle, your lifestyle, sedentary you are not physically active, and you are like obese, you are obese, and you are not going for regular exercise, your food habits are very bad. So there are many things in the food which are carcinogenic and which can change your chemical reaction into your cells and change into the cancer. Other personal factors like let's consider, before it was considered breast cancer is woman is the breast cancer. Now no, men can get also cancer. That's why it was categorized as environment. But for women, like early menarche, like early periods, who have early menarche, late menopause, late childbirth, then after childbirth you will not feed your baby. It was considered not feeding to the baby will cause the breast cancer. Now it is plus minus. Breastfeeding has been taken as a passive factor now, not the active factor, but it is better to keep your hormone level low. At least women should breastfeed after delivery 6 months minimum. So these are the high estrogen level and all that. These are the factors for a woman which can give the these cause of the cancer. But for men, when cancer was found in the men also, in the breast cancer, then people came to know it's not only the woman who gets affected. Men are also almost now we are getting if 100 women is getting affected with the cancer, let us say for example around 100, 3 to 4 women are three are male cancers also. So then that's why it was divided, because of taking the junk foods and their sedentary nature, lack of exercise and totally bad lifestyle changes. Then it was considered no, there are other factors also which can cause cancer. So from that it considered. But now if at present you will see, the heredity factor has reduced to, as I said, 2.5%. Rest all are other factors which can cause. It is not. It didn't confine now only the genetics. So that's why if any female, even a male, will see anything in their breast change, they should consult physician as early as possible. They should not consider, oh, there is a family history. I don't have family history, so it is nothing. No, it's not like that now. No more.
So before we used to assume that heredity is the main factor for breast cancer. Now the environmental factors also influence breast cancer.
Yes.
Okay, doctor, can you now explain about the different stages of breast cancer?
Stages there are actually, we can divide it as per early and late for a layman. Because we cannot tell them there is stage 1, stage 2, stage 3, stage 4. That is for the health professional who can understand this. For a layman, for a common people, when they come with the cancer, we cannot tell them, okay, you have stage 1, you have stage 2, you have stage 3, no, you have stage 4. We tell them like you have early or advanced, late stage. In early stage, we consider, if we change this into the medical terms, early, even we can say first stage and second stage is early. So what is that first stage and second stage? Like first stage is if your breast tumor is 2 centimeter, okay, and because every organ has a one drainage, we call lymphatic drainage, and there is plus minus drainage of your lymph nodes in the axilla, but lump is low, it has not separated to any part. So we told patient it is early stage, and we consider, as a doctor, we are considering it is a stage 1, a grade 1 we can say also. And stage 2, when it is up to 5 centimeter and there are multiple lymph nodes, three more than 3 to 5 lymph nodes in the axilla and all that. So still we are telling patient, you have early, we need to do this operation, and or you may need chemotherapy, radiotherapy, whatever, that depends upon the advanced tests and all that. But still we consider and we tell patient is early stage. But if it is 3, 4 means it is spread to all our body, 3 means whole breast, lymph nodes, plus minus other. So that time we tell patient it is a late stage or advanced stage. So there are, for a layman, for a common person, this is early and late, and for a doctor we categorize it first, second, third, fourth, as I said.
And doctor, how has breast cancer treatment evolved over the years?
See, breast cancer treatment, yes, it has improved a lot for last 2 centuries especially. a lot. Before, when a breast cancer was diagnosed and patient was taken for, there is no radiological diagnosis are very low. Even mammogram came for last 30 years only, and ultrasound and all that, or PET scans, or PAN CTs, like whole body, these were not. So whenever patient was having the cancer, patient was straightway taken to the surgery, and it was not like breast only. Along the breast, below the breast, there is a muscle. People used to take that muscle also, only ribs. Some people used to take even ribs. Yes, it was very horrible type of surgery. Then with time, it became modified, which we called it the modified radical surgery. But they then finally find no, breast tumor doesn't affect. We are taking all this prophylactically. Yeah, prophylactically, yani ki maybe on that guides. This is because diagnostic tools were very less.
Yes,
before. Now there is a mammogram, then CT, then MRI, then PET scans and all that. So treatment also changed. So now modified radical mastectomy, even when now breast conservative surgeries are taken, people are, when now doctors are seeing the size of tumor, the lymph nodes are not, even lymph nodes are there, we will remove, and size of tumor is less than 5 centimeter and all that. Only that much breast doctors are taken, and they are keeping the cosmetic physical appearance of the female. So there is a lot of change in the treatment from before and now. And before also chemotherapy was not that much effective. Drugs was not that much. 3-4 drugs was the common. So everybody was taking that. Now there is also change in the medicines also, and hormonal treatments also, and also better medication. So there is as if this breast cancer, if it gets early diagnosed and it gets treated, and lifespan is as like a normal person. The only thing is the early diagnosis. That's what we are, whenever there is awareness programs or patient comes to us, we always tell them any change in physical appearance of your patient, you feel lump or any change, don't think no, it will go, it is nothing, I don't have heredity, it may be something that, come. It's not necessary it will be cancer, but come, consult the doctor and get it checked out. What is this? If even it is cancer, it will be the very early, and you will get treated, and you will live like a normal, whatever you have.
Now coming to the symptoms, signs and symptoms. Doctor, can you explain the early signs and symptoms one should look forward to?
See, usually there is a signs more than symptoms in the breast cancer. We can say signs. The most indicator for the breast cancer is that when it is a middle-aged, although age is not considered now the factor for the cancer, that middle age and old age will cancer, young age will not get, even young ages are now getting the cancer. I told you this also proved here that environment is the factor. Yes. So lump. Patient will, one woman or man or female or a patient, he or she will feel a lump in the breast, and this, no matter the size, it may or may not associate it with the pain. Whether pain is a symptom, mostly 80% no pain, they are painless, and it is not necessary they will feel lump in the breast only. Sometimes they feel lump in the axilla also. Sometimes the draining lymph node gets more enlarged than the breast before that. So lump is the main sign which, if any patient will feel, any person, female or male, will feel either in the breast and axilla, they should consult a doctor and get it checked out. Other signs are, some people have retraction of nipple. The nipple it gets automatically inside. This is the other sign. Other discharge from the nipple. But suddenly patient will start bloody discharge. Although bloody discharge, we consider it, sometimes it is a papilloma, but still you should get histology of that discharge, or clear fluid discharge, serous discharge. This is suddenly one breast big and one breast gets small. Change in the size of the breast. These are the signs. That's what I told you, signs are more than symptoms. So sometimes suddenly, for example, lactating mother. Lactating mother gets misdiagnosed more than other females, because usually when lactating mother, early lactation, she doesn't feed the baby, so she gets mastitis pain, red tender breast, so she tell, oh, it is a mastitis type. No, because I didn't feed my baby. Or even doctor sometimes misdiagnose it. Okay, she doesn't, it may be the mastitis and all that. We're telling, okay, expel whole milk out and this, but actually it is an inflammatory type of breast cancer. They develop, it is especially it comes during the pregnancy, late months, and during the lactation. So here it should in no way, okay, one physician or a patient should think it get missed, and patient should never think, no, it is the mastitis because I didn't feed, so I will expel the milk. 100% not, it is the cancer, but chances of inflammatory cancer are more in this. We have seen patients like that. So that's why even those females, they should consult their doctor. Is it really mastitis or something else is going on in my breast? So to get tested and checked and all that. So even in these lactating mothers, even they have fever and they have tender breast and larger breast, and they told it is okay, then there will be no fever. No, it's not necessary. So it may be the picture of combination both. So these are the signs mainly,
early signs and symptoms,
to detect the early breast cancer for a female. Any change in this scenario, they should come and consult the doctor.
And doctor, now we know about the importance of self-examination of breast. How often should a woman examine her breast?
Say often, actually no book is writing till now, and it's not how often. Actually better whenever you go for, better for the females, at least when you go for the bath, you are taking the bath, you are already there rubbing your hands on your body. Better to check your breast during the bath. Okay, you forget the bath, now you are going and you are making your dress up, so check your breast that time. Even if you don't have time, at least once in a week, stand up in front of your mirror, see whether your both breasts are equal, bow down, check both are going down equally. Check at least, even not, minimally at least once in a week or once in 15 days, you should palpate your breast with the left hand right breast to the right hand left breast during bath, when we're putting the dress or you are in front of the mirror, at least. And this self exam, because it is you who will notice some change in the breast, nobody can notice. So actually it depends on the self-examination, the main criteria to detect the early changes in your body, in your breast, so that you can take the early consultations or physician advice if you feel anything there is.
You already mentioned about the lifestyle factors affecting breast cancer risk. Can you explain about it?
Yeah, so see, lifestyle changes, there is actually in the female, we have hormones that's called the estrogen. When it remains too much high, so it is the risk factor for the breast cancer. So estrogen comes only when you are too much obese, when you are sedentary, when you are lack of exercise, and you take a lot of the foods which are we can say junk, fortified foods, we can say refined foods. So these are the lifestyle change of risk factors. You don't go for the exercise, you are taking a lot of fortified foods, you are totally obese, you are sleeping too much, and these are the life which can increase the risk of this for the breast cancer and all that. Nowadays you can see there is a lot of PCODs going to be in the girls. What is that? This is also the hormonal change. This is the exposure, this is the low, your hormonal stats and high. So this is the indication that your hormonal value is not. The first of all, when you see these PCODs, 100% in obesity only. So these are double risk factor. In that cases, it can cause you infertility, and infertility it is directly due to PCOD, and infertility is the cause of breast cancer in other ways. So this cycle is going on. So these are all factors are actually interconnected. That's why during periods your hormone levels could dip, and then there is also continuous exposure of hormones to your tissue, especially where the estrogen receptors are high. These are ovaries or your breast. comes down. When there is no periods, you have PCOD, you are obese, you are not going for exercise, you are eating the same fortified foods. So there is a constant prick of these hormones on your estrogen receptors in the breast and ovary, and automatically there will be the change. And it is not necessary now 100% obese or will develop, but this is the big risk factor to develop the breast cancer.
And doctor, what are the latest treatment options available now for breast cancer?
See, latest options, as I said, depends upon the stage. There is no latest depends only. I told you the breast conservative surgeries or breast implant surgeries are there now. Now surgeries are going on like before, whole breast cut, take whole breast, or half breast. Nowadays, if the whole skin above is not involved, inside breast, doctor can put the implant, and we called it nipple and areola conservative surgery. Implant inside, close it, and it will look like a normal breast. Only patient knows, no, it's if any other will see or this physical appearance will remain. And most conservative surgery, I have told, there is lumpectomy is only done, or partial mastectomy is done, or nowadays now there is also the breast augmentation, breast reconstruction surgery by the body parts. Taking the we call it truss flaps, we are taking from abdomen or the back, bringing them to the front of the chest and build up the breast. So these are the latest modification to cure your physical appearance. But at latest doesn't mean that anybody have breast cancer and we will not do surgery, we will not do chemotherapy, radiotherapy, she will go off from this cancer. No way. But yes, you can maintain the shape, physical appearance of breast by latest surgeries. These are the latest surgeries. So you can consider them latest treatment also. But surgery has to go there, and followed by depends whether she need chemo, radio. That is the other factors. But you have to treat it. It's not nothing. Okay, we will give you something to eat and go. It will go nowhere.
Doctor, how can survivors overcome the side effects and emotional challenges during treatment?
Yeah, this is excellent question. Mental challenge is a very big scenario in this. Besides, we are telling them it's nothing, it is early stage, but the word cancer, it breaks everybody's backbone on spot. Okay, even though they show us, we are brave, but internally we know it's big. But as I said, mental balance is a very important factor to fight with this cancer. It's a very important factor. So it is very challenging, and it is very hard to tell them and to make them disagree it is nothing and all that. But at last they have to be brave and fight with this with very good mental balance. And that's why awareness programs are there, even not only to diagnose and all that. Post cancer patients, there is also, and to check them, and they need, many patients need psychiatric, psychological or psychiatric support post-operatively, yes. But yes, 1-2% people are those who are taking it a challenge and fighting with. But I can say the 80% people, yes, they are. It is a challenge. Yes. It is a challenge for them.
And doctor, how do we think the society can support the patients and the survivors?
You mean post-cancer, or who is diagnosed as a cancer, how society can help them? Yes, society can help them, of course. There are many ways of a society to help for a cancer patient. First of all, the society is in your home, your own family members. This is they are the first one who can help the cancer patient, your own family member. They have to support her in every respect, whether it is emotional, whether it is financial, or especially the married woman, whether it is a husband. Husband has to accept tomorrow he should not demand for the physical appearance of her female, she is already mentally baked because she has a cancer, and after some time the husband will feel that she's not physically fit or she's not physically now attractive and all that. You can imagine how she will come out of this status. So first, social, it is at your home. So first first of all, the cancer patient needs support from their family members. If family members are supporting and giving the full support, whether it is financial, emotional, psychological, whatever support to the patient doesn't need social support from outside, because she is fully mentally balanced. She has been boosted up, she has been loved up, she in every respect. So why she needs the care for the others? But of course, if inside, let us take the first, that is the husband, if he is the first one who has to give, married, for a married, then others, kids and mother, father, mother-in-law, father-in-law, whatever, those are the secondary things. So if she is boosted from the inner, that's her own family members, they doesn't. Yes, outside social you need for a poor people. For example, poor people, we know she is a cancer patient, she can survive with the surgery if it's the early stage and all that, but she has no money. Here it comes the social factor from outside. That time people should help and they should understand, they should feel the pain, whatever she will ask for the help or money and other things. Here it comes from the other social factors from outside your home. Otherwise, home is the best who can manage everything at home with their support whatsoever, financial, emotional, psychological, whatever, especially husbands to the wife, especially. This is the main.
And doctor, what advice would you give to survivors who who are scared of recurrence?
I give them recurrence. Yes. See, there is a time for recurrence actually. Although recurrence, it's not like we call them as there is a time when we tell patient you are a cancer free. Okay, so for example, let's take one treatment we are giving the patients, that's hormonal treatment. It goes from 5 to 10 years of the patient, but at 5 years, if there is nothing coming out, every investigation is normal, post-operatively or post-chemo or post-radio, whatever, we are giving patient to the hope. And patient should understand, no, I am progressing, I am good, there is nothing like that, and what is just tablet and eat. After 5 years, we are telling you are cancer free. Some people need up to 10 years. Then after that, of course, they live when every investigation or when everything, we give them counseling. Say, if something has to come, it would have come till now. So it didn't come, that means you have nothing, you are okay, you are just like before or just like other persons you are. And then we are boosting them in this way also. Please, now the one who is already having the cancer, boost them. See, I am the one who is among you, now I am this. That gives, courage to the other patients also. No, when he can survive, he is now 10 years before, why not I? So this goes as a step ladder pattern.
And finally, doctor, what is the one message that you want the viewers to remember after this discussion?
I want viewers that cancer is not something who will kill you. Don't think any patient, any person who will get cancer, even colon cancer, breast cancer, don't think, oh, cancer, now khalas, I'm on the death table and I'm gone. It is treatable, it is curable, but provided if you will not ignore it. This is the only point. Don't ignore any change in your body. Whenever you feel any change in your body, consult the physician, get tested, get early treated. This is the only advice for the patient. Yes, if you ignore, even a normal person without cancer will ignore his or her health, will happen the same, whether it is even not a cancer. Right? So if you feel, the only message to my viewers is that any change in your body, especially breast cancer is nowadays, it is, we cannot say spreading actually. Before I told you diagnostic tools were not less, people were ignoring and all that, and people were dying at the homes, so we were telling cancer was very low. Now because of awarenesses, people knowing, it's breast cancer, they are coming to doctor, so we feel, no, it is too much cancer coming. 10 years before only 1%, now it is 10. It is actually awareness. Yes, of course it is increasing, as I told you, environment factors and all that, what is happening, but it's not that alarming like no, it was nothing, now it is coming. So this is the only message. Any change in your breast, whether it is lump, whether it is retraction of nipple, whether it is one size big, whether it is a discharge, or any change, or in the axilla, in hair. It is not self-examination of your breast only. Also do like this in your axilla, see any node, any lump you feel, whatever. So consult the doctor, get it tested, and feel free. After that, it's not necessary whosoever have lump is a cancer, but at least you will run free. And if it is cancer, you get early diagnosed and you get early treated, and you will live life like a king. So this is the message to my viewers.
Thank you, doctor. Thank you very
very
much.
much.
Really
Thanks
appreciate your words.
Thank you.
So viewers, breast cancer is one of the most common cancers affecting women, but with early detection, education and support, we can increase the survival rates. This month and every month, let's be reminded that awareness can save lives. Till we meet again next time with a new doctor and a new topic, this is Jessila Mujib signing off. Good night.